Good day. Today I'll be sharing with you a video lesson about nursing care for a family when a child has an aplastic anemia, has type 1 diabetes mellitus, and also acute otitis media. Now for today's video lesson, we will only be focusing on the following. First is a general overview of the disease, the predisposing and precipitating factors. Next would be the disease process, the signs and symptoms, the diagnosis, and also the management. For management, I'll be including nursing management, medical, and also surgical management if there is an available one. Now let us delve into aplastic anemia. Aplastic anemia is a hematologic disorder. It results from depression of hematopoietic activity in the bone marrow. So, if ang bata, there is depression sa hematopoietic activity sa bone marrow, of course, formation o ang development sa white blood cells, sa platelets, and sa red blood cells will be affected. Now, aplastic anemia can come in two forms. First is congenital. Congenital is inherited because of the autosomal recessive trait. And the next one is the acquired one. So the acquired aplastic anemia is it occurs when there is excessive exposure to factors that will cause bone marrow suppression or bone marrow damage. So let's go to the disease process of congenital aplastic anemia, also known as Fanconi syndrome. So we only have one predisposing factor, which is ang pag-inherit sa bata sa autosomal recessive trait. When the child inherits that autosomal recessive trait, he or she will be born with congenital anomalies. What are these congenital anomalies? We have skeletal and renal abnormalities, hypogenitalism, and also the child will be born with a short stature. When the child inherits that autosomal recessive trait, naasad siya ay chromosomal breakages. So, mo ni ang reason nga na ay depression sa hematopoietic activity sa bone marrow sa bata. If there is depression sa hematopoietic activity sa bone marrow sa bata, muna nga maafektan ang formation o development sa iyang blood elements such as white blood cells, red blood cells, and platelets. Now let's go to acquired aplastic anemia. Acquired aplastic anemia, motto from previous slide, nga it is due or it occurs when there is excessive exposure. Unsa man nga excessive exposure? So excessive exposure to radiation. So man ni siya mga precipitating factors. We have excessive exposure to drugs, to chemicals that cause bone marrow damage, exposure to insecticides and to chemotherapeutic drugs, and also exposure to serious infections, which will cause nga ang bata, if na siya serious infections, mag-autoimmunologic response ang body nga na ay suppression sa bone marrow, leading to depression of hematopoietic activity. So if there is depression of hematopoietic activity, di ba, for congenital and for acquired, puro sila na depression of hematopoietic activity, syempre maafektan ang formation and development sa white blood cells, red blood cells, and platelets. Now let's focus on platelet. If platelet is affected, ang formation of development sa ato platelet, there will be reduced number or reduced formation, which will lead to thrombocytopenia. Thrombocytopenia, if ang bata na thrombocytopenia, he or she will manifest gastrointestinal bleeding, excessive nosebleeds, the child will easily bruise, and the child will also develop petechiae. So petechiae is macular purplish red spots nga naa sa skin sa bata. Now for white blood cells, if the formation and development will be affected. There will be a reduced number of white blood cells. So if there is a reduced or a decrease in number of white blood cells, it is termed as neutropenia. Neutropenia, if ang bata na neutropenia, he or she is susceptible to contract infections. Because if gamay lang ang white blood cells, gamay lang ang imong protection from certain pathogens, because white blood cells act as kind of like guards against certain pathogens. So, muna siya nga ang bata when he or she has aplastic anemia and decreased pagkat ang iyang white blood cells. So, he or she is susceptible nga magka-infection, and also he or she will respond poorly sa antibiotic therapy. Let's go to red blood cells. Red blood cells will result in lowered count or lowered RBC count and also tissue hypoxia. If there is lowered red blood cell count and tissue hypoxia, the child will appear pale. The child will fatigue easily. The child will also have anorexia. And because the child fatigues easily, he or she is apt to be irritable because of that fatigue. Now, for lab studies or bone marrow samples, na ay reduced number of blood elements. So, mo to siya, reduced platelets, reduced white blood cells, reduced or lowered RBC count. And also, there is fatty tissue sa blood-forming spaces sa bone marrow. So, all those colored boxes are now our signs and symptoms. So, gastrointestinal bleeding, excessive nosebleeds, the child will bruise easily, and so on. So, muna na siya ang signs and symptoms of a child having an aplastic anemia. Now, how are we going to diagnose a child, or how are we going to confirm that the child has an aplastic anemia? So, to confirm the diagnosis of aplastic anemia, and also nga ma-rule out ang other hematopoietic disease, a bone marrow aspirate and a biopsy must be performed. So, what's may significance? Why would they use bone marrow aspiration and biopsy? Ang bone marrow aspiration o biopsy, mo na siya ang mag-provide og sample sa bone marrow sa bata para ma-quantify and ma-identify kung unsa lang nga cells ang gi-develop or gi-form sa bone marrow sa bata. So, manang ma-identify nga na aplastic anemia ang usa ka bata nga pasyente. Now we go to the management. So, let's tackle nursing management first. So, if the causative factor of the aplastic anemia, or let's say the precipitating factor, has been identified, immediate removal of the agent is necessary. So, if ang cause sa iyang aplastic anemia is excessive exposure to the insecticides, so dapat ang insecticides is immediately mawala sa environment sa bata para dili magka-aplastic anemia ang bata. Next is to provide reassurance and support sa family sa bata, including basic explanations sa disease and also sa possible treatment plans nga i-prescribe sa bata. Next is to review the child's prescribed drugs and to discuss the possible adverse reactions. Next is to communicate sa family that monitoring the child's CBC is imperative para manote if mild pa ba or moderate na ang aplastic anemia. Next is to stress the importance of meticulous oral hygiene and diligent hand washing, because pwede nga ang makapatrigger sa iya that insecticides or those drugs may have been in contact sa bata. So, if dili siya manghunaw or if dili siya mag-hygiene, those drugs or precipitating factors may attach themselves sa skin sa bata. And when he or she is exposed to that, so pwede magka-aplastic anemia na sa siya. So muna nga i-stress nato mga nurses ang importance of meticulous oral hygiene and also good hand washing practice. Lastly is to encourage the patient to schedule regular rest periods, to avoid fatigue na siya, and to avoid contacts with crowds, and to avoid surfaces of infections. So that's all for nursing management. Let's go to medical management. So for medical management, we have antibiotics. So antibiotics are given para ma-prevent or ma-treat ang infection. Next, we have hematopoietic stem cell transplantation. Now, hematopoietic stem cell transplantation muna siya ang intravenous or IV infusion of stem cells gikan sa bone marrow sa usa ka donor padung sa bata nga recipient para ma-reestablish ang function sa bone marrow sa bata nga naay deficient or non-functioning nga bone marrow. So, dere, aplastic anemia man, so makatabang ang hematopoietic stem cell transplantation nga ma-reestablish ang bone marrow function sa bata pinaagi sa usa ka donor. So, if there is no donor para sa hematopoietic stem cell transplantation, naasa yung mga procedures para mo-supplement og blood and para sa ma-suppress ang responses sa T lymphocytes. So first, we have packed RBCs, platelet transfusions, cyclosporins, anti-hemocyclobulin, and a RBC stimulating factor such as an erythropoietin. Now, kani sila is given to maintain adequate blood elements sa usa ka patient with anaplastic anemia. Also, an important note, when we administer ATG, we need to meticulously observe the child because ATG is associated with anaphylaxis. So, muna siya to carefully observe the child while administering ATG is an important nursing action. Next is oral corticosteroid. So, a course of oral corticosteroid, such as a prednisone, is given na siya to decrease immune response and also in cases if na autoimmune connection. Lastly is a course of testosterone. Testosterone stimulates red blood cell growth. So if wala donor for hematopoietic stem cell transplantation, mo ni siya ang mga procedures that may help the child to maintain adequate blood elements. Now let's go to the next topic. The next topic is type 1 diabetes mellitus. So type 1 diabetes mellitus is it belongs to endocrine or metabolic disorders. So a quick overview, the pancreas. So we have here the human pancreas. So let's zoom in. So this is the human pancreas. So ang human pancreas is very unique. Why? Kay naa siya both endocrine and exocrine types of tissue. But we will be focusing on the endocrine portion. So ang endocrine portion, naa diha ang islets of Langerhans. Ang kaning islets of Langerhans na siya alpha and beta cells, dili alpha and beta cells. So, ang alpha cells or alpha islet cells, muna siya ang mag-secrete o glucagon, while ang beta islet cells is responsible for secreting insulin. Nung sa may gamit sa insulin, insulin has three functions. First is it carries glucose inside the body cells. Kay ang glucose is ang preferred source of energy sa ato man body. Next is it promotes the liver storage of glucose as glycogen, and lastly, it inhibits the breakdown of glycogen back into glucose. So sa type 1 diabetes mellitus or type 1 DM, Ang naapektan ani is ang islet cells or ang endocrine portion sa pancreas. Ngano? Because of the factors nga i-discuss on the next slide, the pancreas will cease to produce insulin. So, next slide, we will discuss unsa mga factors ang makapasis or makapahunong sa production of insulin. So, first, we have predisposing factors. So, usa na diha ang high frequency of human leukocyte antigens or HLAs. Then we have immunologic damage to islet cells. Then for precipitating factors, we have infection, such as a viral infection. Then we have environmental factors. So these factors result in a failure of the pancreas to release insulin, and there will be ineffective glucose transport. So sa may pasabot sa ineffective glucose transport, meaning, di ba, usa ka function sa insulin is to allow glucose to enter the body cells para magamit sa body as a source of energy. So if walay insulin or there is deficient insulin, glucose will not be able to enter the body cells. So if dili makasud si glucose sa body cells, asa man siya magpundok? Syempre sa bloodstream. If ang glucose managhan sa bloodstream because dili na siya magamit sa body for as a source of energy, there will be hyperglycemia. So meaning, nag-build up na ang excess or ang mga glucose nga wala gi-intake sa body cells adto sa bloodstream, resulting to hyperglycemia. Now, if there is hyperglycemia, ma-detect na siya sa kidney. So, the kidney detects hyperglycemia. So, si kidney will think of methods how to remove that excess glucose. Kay ba man si kidney nga that is not good for your body or that is not good for the body of the child. So the kidney will attempt to lower the normal glucose levels by excreting glucose into urine. So when there is glucose in urine, that is now called glycosuria. So si urine has now glucose, so glycosuria. At this, because there is increased accumulation of glucose in the bloodstream, the kidney's ability to reabsorb glucose and return it to the bloodstream is impaired. Kay grabe naman ang accumulation sa blood glucose dito sa bloodstream. So, ang concentration sa amounts of glucose will result in polyuria or excessive urine production. So there is glucose in urine, which is termed glycosuria, and there is also excessive urination that is termed polyuria. The child will experience urinary frequency, excessive loss of fluids through the urine. Now, when there is excessive loss of fluids from the body, it will trigger polydipsia. So, polydipsia is excessive thirst. So, ang body manggod, when it tries to excessively remove something, it also needs something to add it back. So, ang body magsige siya. So, si kidney busy kay si kidney to release that excess urine through through the mode of polyuria, no? So, mo think si body nga, oh, I need to have more fluids because I've released just tons of fluid through the urine. So, si body, mag-trigger siya og polydipsia, which is excessive thirst. Si body will think na I need to drink a lot of fluids. I need to replace those that I have lost. So that is polydipsia. Also, while those are happening, nag-continue man gyapon ang body to use up fuel. Then we all know that glucose is like a primary source for the body's energy. What naman siya gamiton ng energy? Sa glucose, so muna nga, ang bata is hungry. He or she is always hungry and tends to eat more, which is polyphagia. So despite eating a lot, dili man gyapon na niya ma-retain ang kanayang giit. Kay ang kanang iyang giit will also be used up as sa body. Kay dili naman mo gamit si body sa glucose. So instead of using glucose, ang body will use fat and protein gikan sa gipangkaon sa bata para ma-substitute sa glucose. So mo na nga the bata or the child will continue to feel hungry, so that is polyphagia. So muna ni polyuria, polydipsia, and polyphagia are the three cardinal signs of type 1 DM that is presented as a sign and symptom. Also, there is loss of bladder control, especially sa mga children nga bago lang na-train, o especially if nighttime. So children will have urinary frequency during the night. Also, there may be unintended weight loss because the body will use the fat and protein nga naa sa body sa bata instead of glucose. Also, there is hyperglycemia and glycosuria, nausea and vomiting, abdominal pain or discomfort, weakness and excessive fatigue, increased susceptibility to infection, and signs of dehydration from excessive fluid loss. So how will we diagnose a child? So a diagnosis of type 1 DM is established if one of the following three criteria is present. First is symptoms of DM plus a random blood glucose level greater than 200, then a fasting blood glucose level greater than 126, and a 2-hour plasma glucose level greater than 200 milligrams. So muna siya ang criteria. So if one of the following is present on two separate occasions, the child is immediately diagnosed with type 1 diabetes mellitus. So let's go to nursing management. So how are we going to give therapeutic management to a child or to a family when there is type 1 DM? So first is to stress the importance of adhering to the prescribed program and blood glucose control, to discuss diet, medications, exercise, monitoring techniques, and hygiene, to encourage compliance to lifestyle changes, to emphasize how blood glucose controls long-term health, to teach the patient and his or her family how to monitor the diet, to keep accurate records of vital signs, weight, fluid intake, urine output, and calorie intake, to encourage the patient to verbalize feelings about the disease and its effect on his or her lifestyle, to offer emotional support and a realistic assessment of condition, and lastly is to help the patient to develop coping strategies with the disease that he or she is now experiencing. Now let's go to medical management. For medical management, child with type 1 DM is given an insulin, and also for newly diagnosed child, they are immediately hospitalized or admitted to the hospital. For surgical management, there is one, which is pancreas transplantation. So pancreas transplantation is para lang siya sa mga bata nga mo develop of severe kidney disease or arteriosclerosis. So that's all for type 1 DM. Let us go to the last topic, which belongs to hearing disorders, acute otitis media. So acute otitis media is an infection of the middle ear. So as you can see in the picture, I have there an anatomy of the human ear. So there is inflammation in the middle ear with rapid onset of acute infections such as fever and ear pain. So acute otitis media is a form na siya of otitis media because otitis media has many forms man, but acute otitis media is one of the most prevalent conditions in early childhood mo na ato siya gi-include sa video discussion today. So what are the factors nga makapakos og acute otitis media in children? So for predisposing factors, we have age. So ang most susceptible sa acute otitis media is children from 6 to 36 months and also again at 4 to 6 years. Most susceptible to it are also males, more than females, then Alaskan and Native American heritage, and to those children with cleft palate. Also, children with shorter eustachian tubes and horizontal positioning sa eustachian tubes in children are predisposing factors. Now, let's go to precipitating factors. For precipitating factors, we have formula feeding. Formula feeding kay the position while the formula fed ang mother is more slanted, which allows milk to enter the eustachian tube, leading to this disease. Then we also have homes with a smoking parent, a bacterial or viral infection, limited response to antigens, and also a lack of exposure to common pathogens. So, how does this affect or how does this lead to acute otitis media? So here it is. First, fluid and pathogens from the precipitating factors will travel upward from the nasopharyngeal area, invading the middle ear space. Pag ma-invade na nilang middle ear space, and dili na sila makadrain back sa nasopharyngeal area because of the positioning sa eustachian tube in children. Positioning of the eustachian tube in children is different than adults. And ang eustachian tube in children is much smaller and wider. So it's not able to be as effective as a drainage system for fluids that will most likely travel from the nasopharyngeal area to the middle ear space. So if dili makadrain effectively ang katong mga pathogens or fluids nga mosud dito or mo invade sa middle ear space, ang pathogens mo proliferate and mo invade sa mucosa dito sa middle ear. So if ang pathogens mo proliferate and invade, it will cause inflammation in that area, which will lead to acute otitis media. So what are the signs and symptoms of acute otitis media? First, we have cold, we have rhinitis, we have fever, low-grade fever for several days. Also, because ang katong accumulation sa fluid sa middle ear chamber will result on pressure. So if there is more fluid, so the greater the pressure, and that pressure will bring about sharp, constant pain. Infants will also become irritable and express discomfort and pain kanang ila express through tugging of ears. So ila itag, ila birahon ilang ears to more na siya to relieve pain. Kay increased man ng pressure because of accumulation sa fluid and pathogens sa ear. So by tugging their ears, they are able to relieve some of that pressure and also relieve some of that pain. Also, there is loss of appetite because chewing and sucking is known to aggravate the condition. So how are we going to diagnose? Diagnosis is based on these signs and symptoms as well as an otoscopic examination. An otoscopic examination will reveal, especially if one child has an acute otitis media, an intact membrane which appears bright red and bulging with no visible landmarks or light reflex. So muna siya ang i-reveal during otoscopic examination. Now let's go to nursing management. First management is to advise patients and parents of the patient or the child to provide a smoke-free home environment, because smoke is one of the precipitating factors that will trigger acute otitis media in children. Next is to caution parents about the occurrence of conductive hearing loss. Next is to ensure that the family understands the importance of returning for re-evaluation if the child is not improving or if the disorder progresses to severe illness. Next is to stress the importance of completing the entire course of antibiotics, to encourage mothers to breastfeed for at least 6 to 12 months rather than formula feeding. Then lastly is to encourage the parents to have the child immunized with Pevnar and the influenza vaccine. For medical management, we have antibiotic therapy. Of course, antibiotics are given para makontrol ang infection. Next, we have analgesic and antipyretic. Analgesic and antipyretics such as acetaminophen and also decongestant nose drops, given na sila para mo-open up ang eustachian tube o mo-allow ang air makasud sa middle ear. So those are the medical managements for acute otitis media. So far, that's all you need to know for aplastic anemia, type 1 DM, and acute otitis media. Hopefully you have learned something from this video lesson. I hope you've enjoyed watching it. If you have any questions or clarifications, you can post your comments down sa comment box, and you can also ask your clinical instructors for more clarifications, or you can consult books for nursing, pathophysiology, and other books related to this diseases. So thank you for watching. Hope you had a good time. God bless. Thank you.